For more on this discussion, we're now joined by Professor Sithembiso Velaphi, Head of Department at Paediatrics and Child Health at the Bara Lactation Hospital. Professor, thank you so much for joining us this evening here on SABC News. I mean, this is the first lactation room for the Chris Hani Bara Lactation Hospital. What does this mean for the hospital?
Good evening and good evening to the viewers. What this means is that we will have a space that is called privacy, where the mothers feel that they are treated with dignity, for them to be able to express breast milk freely without anyone watching them. That is one. Number two, there'll be a place where they'll be relaxed and they'll be using breast pumps, which will improve the flow of breast milk. So for us, which means more mothers will be able to give their babies breast milk, and babies will get adequate volumes of breast milk, and which it has been shown that breast milk is the best nutrient, is the best form of milk in terms of providing the adequate nutrients that these babies need, and also it does prevent against infection. So it means a lot for these babies, including their survival and their long-term outcomes.
Why has it taken the hospital so long to establish this lactation room? And what would you say prompted the need for a lactation room?
So, I mean, for us, it has been a struggle for some time in terms of getting the lactation or the number of mothers who give breast milk, in terms of the infrastructure, in terms of the space. So what sort of triggered this is that the rates of mothers who are breastfeeding exclusively, rates are relatively low. So we've been struggling for some time to improve the rates of lactation. So it has been ongoing for years. So it's just that somebody has come up and said, we can assist in terms of getting this done. We also had, we've used a space which was used for equipment, park homes outside the building, because the major challenge is that of space and infrastructure. So when we then moved the equipment out, then we're able to get access to the space. So I think one was to get somebody who's willing to fund and support the area in terms of the space.
How important is this lactation room? And I mean, you speak of the benefits of breastfeeding and basically encouraging mothers to, use their breast milk, because it really does fight infections for their newborn babies.
Repeat your question again, please.
I was saying, what would you say it makes this lactation room very important for the hospital, especially giving mothers a space where they can express their milk in peace for their children, to help, obviously, with the benefits that comes with breastfeeding?
So, I mean, it helps in terms of the space and improving the access to the mothers, because more mothers will get into that space, because sometimes they are sitting in a corner somewhere and you don't have enough benches or enough chairs for them to sit. So we'll have more mothers coming in and being in a comfort space. And again, not far from that area, there are family rooms where these mothers in between will go and have a rest and get adequate fluids, including water, coffee, and the meals. So that room will be supported by that service. And what we're hoping to have long term is to have what we call a breast milk bank, where the mothers who got adequate volumes of milk can give that extra milk that they don't need for their babies, which causes extra, that gets banked or gets stored in a very sterilized way, so that the other babies can get access to that. So this, we see that as a beginning of that goal, where all mothers will be able to give their babies breast milk, even if the mother cannot breastfeed for whatever reason, either is not able to come to the hospital or the first few days where the flow of milk is very slow.
Yeah.
And therefore, all babies will get breast milk. That is our target, is to have more space where we can have more mothers giving out breast milk and more babies. We want 100% giving babies exclusive breast milk.
And talking about those mothers who struggle when it comes to breastfeeding, what support will they be given, if any, at the hospital or the lactation room, especially when it comes to lactation specialists who can ensure and encourage them to, breastfeed their children, even though it seems as if they're struggling in the beginning?
I think the first support needs to actually come even before they deliver. So we are looking to get people who can volunteer or nurses who can come in, even if it's not people who are nurses, people who have some training on lactation, to teach these mothers when they come to the clinic during their pregnancy, so that by the time they deliver, they've heard about all the benefits of breastfeeding. So coming in at the time of delivery, those mothers are motivated. So when they are coming in, they will come in and get education and get all the necessary support and get the breast pump to assist them, and also slowly introduce them to the other mothers who have been there before, as part of that education in terms of training, so that they support each other. They sit as a group, they tell each other as to what has helped them to make sure that the milk flows better. So to have that company and that group of mothers makes a big difference. So they look at themselves as a community of people who can assist each other and support. And even for the hospital, it's easy then for people to access these mothers in terms of training and supporting them.
Professor, thank you so much for your time this evening. That is Professor Sithembiso Velaphi. He is the head of department and pediatrics and child health at the Bara Hospital, telling us more about that lactation room that new mothers can use at the Bara Hospital.